Again, Peter Maberduke, Access to Medicine's Director, Public Citizen. I have the opportunity to introduce Representative Peter Welch, who was born in Springfield, Massachusetts, and graduated from the College of the Holy Cross. As a member of the first class of Robert F. Kennedy Fellows, he fought housing discrimination in Chicago. He's an organizer like all of us. And after college, went on to earn a law degree from the University of California, Berkeley. Go Bears. After law school, he settled in Vermont's Upper Valley, where he founded a small law practice. He was elected to the Vermont Senate in 1980 and later was selected to lead the chamber, becoming the first Democrat in Vermont's history to hold the position of Senate President pro tem. In Congress, Peter is a leader in cutting the price of prescription drugs, investing in energy efficiency and infrastructure, and expanding broadband and telemedicine in rural America. He serves as a Chief Deputy Whip for the House Democratic Caucus and is a senior member of the influential Energy and Commerce Committee and the Committee on Oversight and Government Reform. He is also a co-chair of the House Democratic Caucus Prescription Drug Task Force and the co-chair and co-founder of the House Affordable Medicine Caucus. Please welcome Congressman Peter Welch. Thanks so much.
Thank you, and it's really good to be here. And just to answer Rose's question, or his suggestion, what happens in Vermont, it's all about the Ben and Jerry's, all right? It really is. Just a story of the Robert Kennedy Fellow. You guys are organizers. I love to be here because I was an organizer when I dropped out of college for a year and went into Chicago on the West Side and was working with the Saul Alinsky-style organization. And I remember I wanted to do this between the summer of my sophomore and junior years. And my parents said, you've got to work to make, they paid my tuition, which was affordable then, but I paid my spending money. I had to work to make the money. But I wanted to go out and see this community organization. And over the 4th of July, I had a four-day weekend. So I told my parents I was going to go out. And they didn't believe me because I had no way to get there, no ticket. We had dinner, and my brother went out the front door, I went out the back door. He gave me a ride down to the interstate, and I hitchhiked out to Chicago. And I got there 20 hours later, and within 12 hours, my parents' worst fears were realized. I was arrested, all right? And the community organizing tactic with Saul Alinsky was confrontation. And in the neighborhood, nobody was getting the garbage picked up, so we took the garbage to City Hall, and it got some attention. But what was so wonderful was that the next day, there was like this caravan of city sanitation trucks coming through the neighborhood of Lawndale, picking up all of the garbage. And, you know, what a bounce in the step folks in the neighborhood had, because they had taken action. We were helping, playing a modest role, but organizing works, and we have to remember that. So thank you for your commitment to direct action, where in order to be effective, you have to work with the people who are affected mostly by inaction. And I saw that just recently. I went with Senator Merkley last Sunday down to the border in Texas, and it's unbelievable, you know? It's so heartbreaking, first of all. These people that you meet all fleeing from gang violence, and the president speaks about them as though they are gang members, and every one of them in a desperate situation to make a desperate trip and then having their child taken away from them. And one story after another is horrible. And then, in addition to that heartbreak that you feel as just another fellow human being at the suffering that they're enduring, you realize that it's our government. It's all being done in the name of the government of the United States. And that's our government. And I think Rose's right. We've got to push back to reclaim those generous values that brought you to this place right now. And prescription drug pricing is really an issue where it's all about that. There is a fundamental question that is being debated in this Congress, but in our society right now. And it's, what is the role of government? Does government have a responsibility to help the consumer, to help the everyday person, to withstand the power of monopoly pricing? That's really the fundamental question. You know, I was listening to Roe and all those arguments that they make about they have to innovate and they need the research and they need the money and pricing so that they can sustain it. Those are all obfuscations for the fundamental question: will government stand up on the side of making something as elemental as prescription medicine affordable? And most Western democracies have answered that question. And the answer is yes, of course. The United States has answered that question and said no. But instead of directly saying no, there's enormous amount of obfuscation. So you've been hearing from, I know, your other speakers. You've had a lot of my colleagues here who are doing tremendous work in this about the prices. So I don't have to go over all of that. But let me just go through 4 of the categories. I mean, number one, where the government is not doing its job. The government prohibits price negotiation in Medicare. I'm sure you've heard about that today. But this is unbelievable. We buy wholesale and pay retail. That's literally what we do. And that was required by law. And you know, early on in the Trump administration, Elijah Cummings and I, who were working on a price negotiation bill, we got invited out to the White House where we see the president. And it was a weird interaction. He's talking about Hillary, you know, in Joe and Mika. I mean, we were there for an hour and we thought we were going to be there for 15 minutes. But I'll tell you this, on the question of prescription drugs, he got it. He understood it. It's a ripoff. You know, if he's building a tower and he's going to buy 1,000 mirrors for bathrooms, he's not going to pay the same unit prices if he's only buying 10. And he knows that companies rip off in price. So in talking to him, you knew he knew it. And he gets politically how it's a good issue because a lot of folks who voted for him in rural America are getting hammered on these prices. And when you left, he does the usual thing with us that he's done with everybody else. He tells you what you want to hear. You know, he's for price, he's for drug importation, he's for price negotiation, and, you know, get me your bill. So Elijah and I sent it to him. Nothing has happened. And why is that? And that is an enormous power of pharma, and in that Congress, a deference to the monopoly pricing power as opposed to the responsibility that we have as a government to protect consumers. So that is one. That it is illegal for the Health and Human Services Secretary to negotiate a bulk price discount is truly bizarre. You say that and people can't believe it. So that's like one area. Number two, the government creates one loophole after another to extend the period of patent exclusivity. As you know, with intellectual property, you get a patent, you get a period of time where you do monopoly pricing. And in the old days, that price would be set at something that was in the range of reasonable. Now, the price keeps going up, even though whatever the cost that went into the production of that new drug have been recouped, but the price keeps going up. But the drug companies have found one way after another to extend that monopoly pricing period by resisting generic competition, by not giving samples of their drugs to companies that are trying to make generics, by buying out companies that are about to bring a generic onto the market. That is all governmental action facilitating a continuation of monopoly rip-off pricing. You know, a third area, Congress absolutely refuses to promote transparency in prescription drug pricing or the importation of safe and affordable prescription drugs. You know, all this talk about we can't import drugs because we can't necessarily vouch for their integrity. A lot of the drugs we have in this country are manufactured abroad, right? And last I noticed, they're for sale here. Yeah. So bogus, right? And we have our inspectors who go over to these factories. So no excuse. I mean, that's where I was listening to Roe. There is no excuse. But again, another governmental action that is making it impossible to even let there be market competition. And fourth, and this one in many ways is the absolute most appalling, Congress has enabled the financialization of the drug industry. You know, the point Roe made, I agree with. A lot more money is spent on advertising than on research. And also, a lot of the research is paid for by you and me as taxpayers. But what the finance people figured out on Wall Street, like at Valiant, or that Martin Shkreli, who is just an example of an absurd, weird genius who made a lot of money. If they can buy a company that has the right to a drug, no research involved, they can boost the price enormously, pay for that acquisition, and then keep pounding away on that price at the expense of taxpayers and individuals. So it's all fixed as the reason, not accidentally. These are all conscious policies that are aided and abetted by governmental action. And you guys it's so important what you're doing to help us expose this, to make a basic demand for fairness, and actually a basic demand that your government in mind accept the responsibility and the opportunity to have public policies that help the public, not just the big companies fatten their profits. And that is a worthy mission. And, this election is going to be really important. But one of the issues that we're going to push again, and the last time the Democrats were in the majority, we did get prescription drug price negotiation through the House. We weren't quite able to get it through the Senate. But this issue has just gotten more and more severe. And there's two alternatives if we're going to have a healthcare system that works for everybody. One is what we saw with the Republicans in their effort to repeal healthcare. And their answer for the cost of healthcare was to take healthcare away from 24 million people. All right? It can work. That reduces the cost. People die. They get sick. They suffer. But that's, I guess, one way to bring that cost down. The other is to go after these outrageous profits that are being facilitated by price gouging policies from this Congress and this president. So that's the direction we're heading. We want to make health care affordable because we know how essential that is to every one of us. One day or another, we're going to get sick and we're going to need it. One day or another, somebody we love is going to get sick and is going to need it. And that has to be affordable when that time and moment comes. So keep up your good work. I really appreciate the opportunity to be with inspiring people who don't know that they're supposed to behave themselves at all times and are willing to do what it takes to get things done.